Hi, my name is Ashley Graham, and I will be presenting common gaps in knowledge about syphilis, what we can do to fill in those gaps, and further research that can be done to improve the surveillance. So, common gaps that I've seen are in the gender category, particularly homosexual males. Since 2000, syphilis is known to be highly vulnerable to the homosexual male population. In fact, enhanced surveillance data has shown that 50 to 60% of homosexual men who are infected with syphilis are also affected with HIV and AIDS. When analyzing data for syphilis, it has become difficult to evaluate and is very limited because not many people are getting tested after getting after getting tested twice, despite the protocol that HIV and AIDS has that someone should get tested every 3 to 6 months. And this is due to often these men are in fear of getting or being discriminated, or they feel that they get poor health quality care, so they feel the need not to return. So, what can be done to fill in those gaps? Well, always the usage of safe sex methods to avoid STDs, but most importantly, interventions. Rates of syphilis are high due to unsafe sex and having multiple sex partners. So, interventions are needed for syphilis victims. In the past, interventions have shown to have little impact on syphilis victims because their interventions were too short. Therefore, there is a need for a meaningful evaluation for interventions that start to decrease the rate of STDs. There is also a need for quality healthcare regarding STDs. Primary care practitioners can help endorse a good relationship with their patients in order to increase their awareness about syphilis screenings and to offer assistance to help cope with the infection. So, this will create a more gay-friendly primary care center or a friendly care like environment, so that they feel comfortable enough to receive treatment. So, suggestions for further research. Well, syphilis prevalence data is necessary to be used to access the number of specific screening activities performed by doctors treating or testing for syphilis, and to identify the number of new cases detected in relation to the number of screenings tested. Also, having syphilis prevalence monitoring at local, state, and national levels can be used to monitor and maintain disease burden and trends. So, this can be able to identify the target populations that are susceptible to high rates of infection and to analyze case report surveillance data. In areas with considerable morbidity, surveillance data needs to be analyzed on a monthly basis to supervise changes in incidence or new patterns of diseases. And also, there is a need for cases to be reviewed. The monthly overview can be a routinely process that will allow doctors to monitor changes in incidence or patterns of disease. Overall, records should be evaluated by categories such as demographic and risk behavior characteristics, including gender of sex partners.